Have you ever wondered why, even after trying every diet, supplement, and doctor's visit, that your autoimmune symptoms and fertility struggles just won't budge? Are you tired of being told to just manage your symptoms while the real root causes are ignored? Well, what if the answer lies in your gut and the way your body handles stress? If that sounds like something you've been going through, you're definitely not alone. So many women with autoimmune conditions and fertility struggles are stuck in a cycle of endless testing, confusing results, and generic advice that never really gets to the heart of the problem. Welcome back to the Health Bridge podcast. I'm your host, Holly B, and I help women with lupus and other autoimmune conditions reduce flares, regain energy, and reignite their inner light, all through holistic approaches that can work alongside Western medicine. Today, I'm being joined again by Dr. Aumatma, a holistic fertility expert and naturopathic doctor. We're diving deep into the science of gut health, how it drives both autoimmunity and fertility issues, and why the right testing and the right practitioner can make all the difference. Plus, we're going to be talking about the real impact of stress, sleep, and movement on your hormones and your immune system. By the end of this episode, you'll know how to spot the hidden triggers that are keeping you stuck and the first steps to finally break free from the cycle of infertility and symptom management. Make sure you stick around to the end because we are answering the question, what's really going on beneath the surface and helping you start healing for good? Before we dive in, can you please take just a moment to subscribe to this podcast? It makes a huge difference in the reach that we get, and it's so important that we get these messages out there so people can have more autonomy in their health journey. Thank you so much for taking a moment to do that, and now here is part 2 with Dr. Aumatma. Dr. Aumatma, welcome back for part 2 on fertility and all of the things we need to know if we are looking to get pregnant or keep a pregnancy. This is, again, just a really deep dive, part 2, into everything that we need to know that we were not taught.
Absolutely. Thanks for having me here, Holly.
Definitely. So, just for a quick recap for anybody that hadn't listened to part 1 yet, we really got into basically like a hormones 101 class with our first episode where we went over the basics of what a cycle should look like, ideally, and what are PMS symptoms? What does it feel like when I'm ovulating? That sort of thing. And we got into some of the fertility issues there. But in this episode, we're going to do more of a deep dive into lifestyle things that can come into play to either hurt or help our hormonal cycle. And really, that's whether or not you're trying to get pregnant, it doesn't matter. It's going to help you overall in just keeping your hormones where they should be. Let's dive right into gut health because we briefly mentioned it in regards to autoimmunity and getting down to root causes last time of infertility. You were mentioning that with autoimmunity, and I've seen this as well, that gut health plays a huge role and is often a root cause of autoimmunity displaying. And you've seen that with fertility as well. So let's dive into gut health. What is your take on gut health and what are you seeing in your clinics?
Yeah. There are so many factors with gut health. So we kind of like group it all into one, but your digestive system just does so much. And I think we don't realize like how much is actually happening when we put food into our bodies or water even into our bodies, or for fertility people, all the supplements that we put into our bodies. It's not really clear for people like how much of a difference things can make. So if we just go from top to bottom, like your mouth actually is the initial part of your digestive tract, and there are bacteria in your mouth that are helping to stimulate digestion, the release of enzymes, all kinds of things. What's really interesting, and we don't clearly know the why yet, is if you have oral microbiome dysbiosis, meaning there's an imbalance of the good stuff and the bad stuff, then the likely chance that you can have vaginal microbiome dysbiosis is like much, much, much higher and almost always correlates. So whatever is happening in your mouth is likely to be affecting your vaginas and reproductive tract microbiome, which right now is like the cutting edge in fertility. It's where so much of the research is headed, is how are these different microbes impacting whether or not people can get pregnant, what egg quality, whether the sperm can make it, whether implantation is going to happen. It's all dependent on microbes. If we have this dysbiosis, then we're going to have issues. And similarly, I will say that root canals often have like little cavitations or pockets that will hold bacteria, which then contributes to this dysbiosis. It actually contributes to triggering the immune system enough that it can keep people in a low level of fight or flight, even if they don't have any symptoms, right? So with the mouth, it gets really tricky if you've had dental work, if you have mercury fillings. Those fillings can be off-gassing mercury, which is a problem for fertility. So that's the start of the mouth, the start of the GI tract. And then we go into the stomach. And the stomach is where we see a lot of like H. pylori and deficiency in hydrochloric acid. They can kind of coexist because low stomach acid will also allow H. pylori to like hang out in the stomach when high stomach acid will get rid of it. They can coexist, but really the main part in the stomach is breaking down the food, and hydrochloric acid is going to help support doing that. Adequate hydrochloric acid production will also help enzymes, the production of enzymes, bile, stimulate liver detoxification. So there's like kind of a domino effect of things that the digestive system is starting to stimulate as we move food through the process. Then we get the gallbladder, pancreas, all of the mid digestive system organs, the liver, which is like ancillary or like the sidekick of the GI tract. So it's not actually in the tract, but it's correlated and it's getting stimulated and triggered by things that are happening in the GI system. So the food goes down. If you had adequate digestive enzymes produced, great, because now the food that your stomach broke down can start to be digested and throughout the intestines is going to be absorbed into our system to support nutrition and nutrients that we need in our bodies. So that's kind of the overview. What we see a lot is that because most of what's happening in the intestines is microbiome driven, there are high chances of microbes that shouldn't be in your gut being present and the ones that should not being present. And when there is an imbalance, there are likely chances for more inflammation, more issues absorbing what's really nutritious and like the rest of the body needs. And if we have trouble absorbing these nutrients, then for fertility, that's a direct impact. Those microbes are also responsible when we talk about hormones. Some of those microbes make up what's called the estrobolome, which is helping to detoxify or metabolize estrogen out of the body. So for people that have a high estrobolome, there's going to be a recycling of estrogen, which then causes quote unquote estrogen dominant scenarios where people don't understand why they have high estrogen or, oh, I'm not taking any supplements for that. But there's like this dysbiosis that's lending itself towards a problematic hormone metabolism. And And then like adequate fiber, which I feel like we don't talk about enough. But if we don't have adequate fiber, which so many Americans are deficient in, we're not actually moving crap out of the body. And you could be pooping every day and still not getting enough fiber. And that fiber is actually going to be important because it binds toxins, it binds hormones. There's all kinds of things that it is helping to like kind of vacuum in the intestinal tract to get it out of the system. So if we're not doing that efficiently, then we have a lot of these toxins and things floating around in our gut that then will get reabsorbed because the body says, well, if they're still hanging out there, we must need them. So let's just suck it all back. And that creates a lot of like recycling of hormones and toxins that we don't need and we were actually hoping to get rid of. So that becomes problematic. There are specific microbes in the gut, specifically Staphylococcus and Streptococcus, that have a good amount of research that they directly negatively affect fertility. And we don't exactly know how or why, but we know that the presence of these bacteria in the gut can be contributing to fertility issues. We also know that H. pylori, specifically in men, it does affect women also. And I think that there's different pathways for that. But just the presence of H. pylori in male bodied humans is going to negatively affect fertility and sperm. So there are these like direct correlations between GI microbes and what's happening with our fertility that is crucial to understand. The last piece of the gut, sorry, this is like such a long thing, but the last piece in the gut is that our gut is actually one of the biggest like barriers for the immune system. So when we're getting exposed to things, it either is our skin is the first barrier. So if we're exposed to something externally, the skin does a really good job protecting us from that. And then, of course, the stuff that we breathe in is protected by our nasal microbiome. But when things go in through the mouth, that's getting filtered through the gut. And if there are problems, so these microbes kind of act as like a barrier mechanism. And if they are dying away, or if it's the not so good stuff that isn't doing its job, then the likelihood that the intestinal barrier, the integrity of the lining, becomes weak. And this is sometimes called quote unquote leaky gut. I don't like using that terminology, but it does describe what it's not like actually leaky and you're not getting like your food is not going through your gut. But it describes to a certain extent that there are these gaps in the intestinal lining barrier. And that those gaps will allow food proteins in only to the second barrier. But that second barrier is the immune system. So now when things leak through, the immune system in the gut is getting activated and it's saying, oh my God, attack. Oh my God, attack. And it's actually attacking food proteins. So it's not actually attacking things that are bad or they're not microbes that are trying to take over. It's literally just like I ate some kale and now I'm getting a reaction and my immune system is like, oh my God, it's poisonous. Let's get rid of it. Then that degree of immune flare up is it's going to cause inflammation. A lot of people see bloating or gas. Some people will describe postnasal drip as a consequence of it, or having like allergies, frequent allergy attacks. All of those are kind of symbols or signs that potentially the lining of the intestines is weakened. What is the second piece of this is if we have this weakened gut barrier, then the likely chance that it is affecting the uterus and a similar thing starts happening in the uterus where the lining weakens and again, the immune system is getting overactivated, there is a likelier chance of recurrent pregnancy loss or pregnancy loss period. So if this thing is happening in the gut, it often mimics, or the uterus kind of takes on whatever is happening in the gut and says, "Oh, I must need to do that too." And the immune system gets activated, implantation happens, and the immune system goes, "Attack! What is that?" and starts attacking the embryo. So a lot of the times there what's happening in the gut often gets confused and then starts happening around the body. And we'll see this with Hashimoto's, for example, is probably the biggest example. The gut immune system overactivated, then it started going around the body and saying, "What else do I need to kill?" And then mistakenly starts attacking the thyroid, the uterus, the ovaries sometimes. So it will affect egg quality. Um, so we can really get this like autoimmune infertility issue across the body, but it's starting in the immune system that went haywire in the gut. And the fix for it is relatively simple. It's to know what foods are creating this trigger. And it's not just IgG. So a lot of people get confused and or like really good marketing on some companies' parts. I won't say any names, but they're very popular and you'll see all of their ads on social media. And they're testing IgG food protein flare-ups. So IgG is one part of the immune system. It's one of like 20 cells, different immune cells that could be getting activated. And that's what they're testing to figure out if you have food sensitivities. Unfortunately, the problem with that is it's a very incomplete test. So you might see things on that test and you're like, yeah, this is basically my diet. What am I supposed to do with this? The problem is that they're not really testing for all of the other rest of the immune system, which is often where the answer is. So getting a more comprehensive food sensitivity analysis to be able to say, okay, here are the food triggers. Let's heal the gut lining. And then we can't forget that if the microbes and the dysbiosis in the gut is what caused that issue to begin with, then we have to heal the microbes that are creating the problem. So that's kind of the overview of everything that I'm thinking about when I'm looking at someone and saying, hey, we might need to look into gut issues. And usually we'll see imbalances in white blood cells on a basic blood chemistry test will trigger potential need for more testing on the gut side.
Got it. So you're starting with basically a regular blood test and looking at the white blood cells. If that's showing you indication, then you're moving forward with more extensive gut sensitivity testing.
Yep.
And
Yep.
would you recommend on people on their own, if they're having fertility issues, that this might be just a good path to go down regardless? Can we order these tests ourselves for the gut testing?
Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode.
It is overwhelming. Even for practitioners, I think it's overwhelming. So finding someone that can actually like not just do the test. Sure, you can order the test for yourself, but the problem is like what happens with the results of that. And I have a client just now who she's like, my midwife orders all of these tests for me. And I'm like, okay, great. Send me the results. And she did a Dutch test, which is a specific hormone test that we can get into. And I wrote her back and I was like seeing all of this stuff on her test that I was like, oh crap, I wish I had had this before, because I had talked to her a few months ago. And then she was like, oh, I'm just going to stay with my midwife. long story short, I was like, so what did you do after getting all of these results? And she's like, I don't know. My midwife said it was bad. And I was like, what? Like, that's it? And she's like, yeah, I don't really know what to do with it because, like, I was just told it was not good. And now what? And I'm like, okay, yeah, I agree. It's not good, but there's a lot for us to like work through on this test. So it's really, it's important that the practitioner that you're working with, regardless of who ordered the test, because that part to me is irrelevant. As long as you do the test in the right way, it doesn't really matter. But the results from that test, it's going to be left to the interpretation of whoever they're working with to say, hey, this is actually impactful for fertility. No, this doesn't matter. Like, leave that alone or don't go down that rabbit hole. So really figuring out like how much of this do I need to pay attention to and what do I need to do so that I can support my fertility becomes very nuanced.
I definitely agree with that. All the tests can be, again, so helpful, but so overwhelming. Just as an example, I had a gentleman on my podcast who owns a genetics insight company. And so I went through genetics testing with him and I was all excited. And then I got the results and I was like, oh my God, this is so overwhelming. I don't even
Yeah.
know what to do with this, you know?
Yeah.
And
Yeah.
so, of course, I went back and had a consultation with him, which helped to clarify things. But yeah, it's a lot of information. And if you don't have background in this health field, then as a layperson, you might not be able to interpret it correctly for yourself. So yes, I totally agree with you. Definitely working with a practitioner on that is going to be vital, whether that's for fertility, whether that's for just gut health period, whether that's for autoimmune conditions, because they're all going to have a slightly different angle.
Yeah. And I think it's really helpful to find the specialist for the thing that you want the outcome with, right? So if your goal is treating your autoimmune condition, then work with someone who has experience with that particular condition. It's not super helpful for, I feel like there's a lot of like functional medicine practitioners that are just generic medicine practitioners. And I like have a lot of them as clients because they're like, well, I ordered all this stuff and I've been doing all these things and it's been 2 years, 3 years, 5 years, and we're still not getting results. And then I look at their stuff and I'm like, yeah, well, I see why you're not getting results. This is not really like you're trying to chase a rabbit down the wrong hole. And for fertility, it's very hyper specific. And that's why when people are like, oh, can you help me with menopause? It's all hormones, right? I'm like, no thanks. Like, not my jam. I only do fertility. I only want to know everything there is to know about fertility. And like when a new test comes out, all these companies are always like, hey, you should try our new test. And I'm like, okay, yeah, tell me how this connects to fertility. And they're like, oh, not really, no. And I'm like, yeah, no, we're good. We're good. We don't need any more testing. So really like being able to not get into every rabbit hole, but really knowing that, hey, these things are going to make a difference for my fertility. And I'm working with someone that knows exactly what it is that it needs to impact, and they know what to look for on the other side with results to know that that's been effectively addressed and it's not still impacting my fertility. So I think so much nuance in the whole functional medicine space, and it's unfortunate because I'll talk to people that are like, well, I've moved on to IVF because I work with 3 other practitioners and they couldn't help me and I took all the supplements. And are you just going to give me more supplements? And I'm like, yeah, I'm going to give you supplements, but it's very different to have targeted supplements versus here's some generic stuff that we give everyone for fertility. So there's so much confusion out there.
Definitely, definitely. And while we're talking about gut health, talk about insulin resistance.
Mm-hmm.
I'm sure
Yep.
that has a huge impact as well.
Huge impact. So insulin resistance is basically, I like said it and then I never went back to it, which is the pancreas. The pancreas releases insulin, and the goal of the pancreas is to, whenever there's food present, to allow for, once the breakdown of that food happens, it all turns into sugar. So insulin is released as a hormone that attaches to the receptors on cells that need glucose to function. So the insulin goes and attaches, and then the cell walls open up to allow the inflow of glucose, and then it closes up again. This insulin resistance is when this insulin is produced, it attaches to the receptor, but it does not, like, the action doesn't happen. So either the receptor is kind of wonky, it's not doing its job, or there is like more and more amounts of insulin present that the receptors are kind of becoming dull to it. So they're like, this is overwhelming. I don't know. There's always insulin floating around. I don't know that we're supposed to do something with this. So the signaling gets a little wonky. And the direct impact that it will have on fertility is potentially leading to anovulatory cycles. And we see this a lot in, of course, PCOS or polycystic ovarian women syndrome women, but it can happen even if you don't have PCOS. So you don't need the formal PCOS diagnosis. You can still be having anovulatory cycles if your insulin is dysregulated. Our goal is to really have enough insulin being produced that it has the action and that the receptors do their job in like the step that they need to do, and that the sugar doesn't float around in the bloodstream for too long. So having glucose floating around for long periods of time can lead to inflammation, essentially. So we need enough insulin to get that glucose out of the system into cells where they need it. And that would be the optimal. And when that doesn't happen, cells are not getting enough glucose, which means they don't have the energy to do what they're supposed to do, which can affect all kinds of fertility things and general health and well-being things. And specifically around the ovaries, creating this scenario where the ovaries can no longer ovulate in every cycle becomes extremely problematic if you are trying to get pregnant.
Yeah, and like you said, it's causing inflammation, which can trigger all kinds of things through the body. So for one woman, it might be the fertility issue. For another woman, it's whatever else you're pregenetically disposed to,
Mhm.
or predisposed to. And so we see that a lot with autoimmune conditions too, where inflammation caused by insulin resistance can trigger any number of autoimmune conditions to start presenting. And when we can regulate the insulin and create better metabolic health, the inflammation goes away and everything calms back down.
Mhm.
So, yeah, just another powerful approach to overall health, but also supporting your hormones, supporting your fertility, supporting, just your stress levels, everything, right? It
Yeah.
affects it all.
Yeah. Yeah, absolutely. And this is probably going to correlate to where you want to go next also, which is there's evidence that if you don't get high quality sleep for one night, the next day you're going to have insulin issues. Right. So there's like a direct impact of how well you sleep through the night is going to impact what your insulin does for the entire rest of the day, the next day. And similarly, if your morning cortisol goes haywire, meaning either you wake up with too much cortisol or your body releases cortisol because you went into a fasting state by mistake. You had your coffee and maybe a donut or a bagel, and your blood sugar spikes up and then it spikes down. Or a lot of people with the intermittent fasting, which I think is terrible for women most of the time, PCOS women aside, but going into these like high intermittent fasting periods will have your body pushing out cortisol because it's your body still needs to survive and have energy even if you don't have food. So the way that it does that is push the adrenaline, norepinephrine, cortisol systems, essentially putting you into fight or flight, and that will get you enough energy to like go till 11 or 12 when you decide you're going to eat your first meal. So if that happens, that is going to stimulate a difficulty with insulin the entire rest of the day. So all of these different pathways and hormones are interconnected, and they're like constantly talking to each other about what's happening in the body. And like that's partly for me, like that's where the magic is like helping support your circadian rhythm, getting to bed at time on time, waking up on time, getting sunlight in the morning, staying away from blue light at night. Like that becomes the foundation of all of the hormones in your body. I don't care which hormone it is, it's being affected by what you're doing at night. And if you are staying awake till 3 in the morning because you have to work and you're on a computer and your pineal gland is getting all of this blue light and is making any melatonin, and you didn't sleep and you're waking up and running on cortisol, that's a really hard comeback. If you do that once a week, that's hard. If you do that every day of the week, I'm pretty much like, okay, you're fired. Like, there's no amount of supplements that I'm going to give you to compensate for what's happening with your circadian rhythm. It really, like that, to me, that system is the foundation of everything, especially female hormones, but in general, everything. And you can have perfect hormones, which I saw this yesterday. This woman has amazing testosterone levels, everything's good, but she's like, I have low sex drive, and her cortisol is a flat line. And I'm like, yeah, I don't think it's your testosterone actually. And she's like, what? And I'm like, yeah, it's your cortisol. That's probably what's causing you to have low sex drive. She's like, huh, I didn't think that was possible. Or I think that it all leads back to what's happening in your sleep wake rhythms.
I'm so glad that you brought that up. Circadian rhythm regulation is one of the biggest things that I coach on with my clients because, like you said, it is the basis for triggering every single hormone function in the body. And you basically said you can't out supplement a bad sleep routine.
Yeah.
You can't out supplement blue light after 10 at night. Like you can't out supplement not running on cortisol in the morning. You have to create these lifestyle changes in order to help support your system at that truly foundational cellular level for optimal functioning. And so we can do all the other things and take a million supplements and change our diet and do all these things. But again, if we have a lifestyle that is not supporting good sleep and waking up well in the morning, it's only going to do so much.
Yeah. Yeah. Yeah.
So yeah, I'm so glad that you said that. What about like movement, exercise? Where does that come into play specifically for fertility?
Yeah. So important. I think there's a lot that I could say about movement and exercise, but in general, if you were a client, this is what I would tell you. You, as a female bodied person, you are weightlifting at least 3 times a week and you are getting 7,000 steps a day. And I know everyone knows that it's 10,000 steps. The research is actually for 7,000, and I hate walking. So I'm like 7,000 or better. If you want to do more, go for it. But most of us aren't even getting that much, right? Like we're getting 2,500 to 3,000 if we have a sedentary lifestyle. So if we just get moving and walking more, that's great. Ideally, we would get that outdoors. So if there's a way to have sun exposure throughout the day, that actually helps the circadian rhythm all around. So if we can get first morning sun, that's the best. Midday sun is really great. And then evening sun is second best. So between those three, if we can get out and walk, and you're walking for like 10 or 15 minutes each time, that's perfect. So that's my general, like, if you are not working out at all, that's the baseline to start with. And the weight training is really important because it's helping muscle, it's helping calcium, it's helping your body to essentially fix its own hormones by doing the workouts. The more nuanced or step 2 of this is for all of my ladies that love to do high intensity interval training, hot yoga, all of those types of things.
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied, will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So, if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode.
My suggestion is that in the follicular phase, during the menstrual cycle, you're not required to do anything. You want to sleep, you want to rest, you want to rejuvenate, do some like gentle yoga, great. Walking, continue your walking, right? Like menstrual cycle, you're off. You get to take those days off. After that, up to ovulation, that's your follicular phase. And during this phase, if you want to do the high intensity stuff, this is the time. So do as much high intensity as you like. I try to be like, go to like 80 to 85% of your max. Don't get to the point where you're exhausted and you're like, oh my God, I can't move. I don't think that's healthy for anyone, but you can push yourself as hard as you like. Then after ovulation is the luteal phase. And during this phase, you're going to pretend you're pregnant. So all the high intensity stuff, you cut it way back. If you're at 80%, you're cutting it down to like 50%. If you're at 90, you're cutting it down to 60. So this is your own threshold and you are self-regulating. So if you're still going to go to your high intensity class, you're taking it down a notch and not pushing yourself as hard. Maybe you're cutting back a little bit on weights. If there's like my bar class is kind of intense and she'll have us doing like 30-pound weights and we're doing all this stuff with it. And I'll just pick up the 5 pounds during that phase, right? Like no shame, no like, oh my God, I'm going so lightweight. It's all good. It's supporting your hormones to not overdo it during the luteal phase. Just cutting back on everything. You could also do less frequency. So if you were going 3 times a week, you can go once a week. If you were, you're just kind of like switching it up to get more more rest and rejuvenation and rebuild during that phase.
With my clients, we're, looking at autoimmune issues, and a lot of times we are at that very low starting point of exercise
Yeah.
and movement. And a lot of times there can be sun complications with lupus, sensitivity to the sun. And so we modify that appropriately. But I also totally agree in getting out in the daytime throughout the day. So
Yeah.
as soon as you get up in the morning, midday, and towards dusk or, evening time, getting out to trigger that hormonal process in the body. And there's just something I think that's so healing about being outdoors in real air that's not stagnant indoor air. You know what I mean? Like
Yeah.
that's part of the process too. So just know that if you are on the autoimmune spectrum, just like you're recommending shifting your intensity levels depending on where you're at in your monthly cycle, we can also shift the intensity levels based on where you're at in your autoimmunity and inflammation and pain, and we can work with all of that. So don't be intimidated is all I'm saying for any of my autoimmune listeners out there. And to pull things full circle, let's talk about stress and being in fight or flight. And I know that plays a huge role in fertility as it does in autoimmunity. And so how do you dial in for your patients the role that stress is playing when oftentimes I think it's really hard for us to even identify that we're in fight or flight? So how do you start teasing that out for your patients?
Yeah. Yeah. I think it's probably the hardest. And I think for fertility, especially, so many women are told, stop stressing, just relax, it'll be fine. Like those are the messages that they're getting. And it becomes almost a cyclical loop where they end up feeling more stressed now that they're stressed, right? They're like, oh my God, I'm stressing about my fertility, or I'm stressing about getting my period. And now I'm like feeling ashamed and guilty and annoyed with myself that I'm stressed about it. So I prefer to think about stress as you can be in stressed out mode or you can be in stress resilience. And stress resilience is not a state of zero stress. It's a state of being able to have your body adapt when stressors arise and recognizing that when you are in a stress state, your first is like the awareness of how does it feel in your body? What triggers your brain to be like, oh, I'm stressed? And getting that awareness is really, really important because so often I think we are not aware that we are stressed. And I have a funny example for this. I was in medical school and we were walking to my dorm room in school, and it was me and three other friends from class that were kind of like the four of us were like the crew, right? We had our like little study group, and all the time we hung out a lot. So they're like walking to my dorm room, and I'm like opening the door, and I sighed, and one of them said, "Hey, are you stressed? Are you okay?" And I was like, "What? I'm good. I'm not stressed." And just like brushed it off. Didn't think about it again till after graduation. I spent some time in a monastery meditating, and I felt what it feels like when I'm actually fully like dialed down, where there is no stress hormones happening and like normal circadian rhythm, cortisol pattern, and all of that. And I was like, oh my God, if this is what my body feels like when I'm not stressed, I was way stressed, like way stressed that time that my friend said this. And I literally was thinking that thought in meditation, and I haven't forgotten it because it's just that the more that we are in this mode, constantly stressed out, our body's continuing to adapt and become okay with higher and higher levels of stress. So it's sort of like if you were drinking alcohol and you have higher and higher levels of tolerance, it's literally what the body's doing. It's like higher and higher levels of stress tolerance. And before you know it, you are super stressed, but your body doesn't recognize it. So instead, the first step for anyone that is like, I'm not stressed, is starting to gain awareness and having the time to unplug, even if it's a weekend where you're just unplugged from all of it. You are maybe going camping or spending some time in nature and doing a little bit of meditation. This is not one of these like vacations where you are doing a million things and drinking alcohol and partying it up with your friends. That's not the thing I'm talking about. This is like quiet alone time where you can be in nature, will help you reset and really get tuned into like what it feels like when you're not super stressed. So we need to know what our baseline is, right? Like how does my body actually feel when I'm not in that super fight or flight mode? Once we can have that, then we can go back to our life and we can say, "Oh, when I start feeling my heart pounding, that's a really good sign that I'm stressed." Or when I'm sighing, for me, when I'm sighing, that's a really good sign that I'm a little stressed. Or when you're getting headaches, that's a good sign that you're stressed, right? So you have to figure out and tune into what your body's signaling system is. And everyone is different. We're all going to have different signals that our body is sending as a response to, hey, there's too much going on. I need some time to unwind and slow down. So that's the first piece. The second piece is having a toolkit that we can use that are almost instantaneous resets. And we can do one of these if we want today. Um, so my goal is to stack up as many resets as I can for people because our stresses are not going anywhere. Like most of the time, we're going to live with them. And sometimes people are like, oh, should I quit my job? Is that going to get rid of my stress? And I'm like, well, maybe. Is that what you think will happen? And they're going to be like, yes, my boss stresses me out. My work is stressful. And they will quit their job and then they're still stressed or sometimes more stressed than they were when they did have that job. So it's really, really important to not externalize it as like, oh, something else is causing me this stress. It's almost always like, this is my body's response mechanism to the things that are happening around me. And if my nervous system is regulated enough to not get triggered every time there's a stimulus, then I'm good. Like that's the state of health, right? Like, and no one's going to be there all the time. We're going to get stressed. And you're like, with our approaches, like we're doing the mind body work in our fertility program every single week. So every week there's a reset and that helps people like reset their nervous system. They're like, I feel amazing. Great. And then they won't do anything all week and then come back and like, feel like shit again. And we'll do the reset again. But the key is like the reset, knowing what it feels like, and then doing what you can to like, when you have a blip, okay, what tool can I use to get back to my set point? And keep doing that frequently. And that's the work. That's the hard work. And it gets so hard when people are trying to conceive because every month there's this whole roller coaster that you are now having to deal with. And that alone is stressful. And I feel like we see this so often when our ladies are like perfect hormones, everything looks peachy. We've done the labs, everything matches up. And then we're like, great, you're ready to go start trying. And their body just freaks out and all the hormones go out of whack. And then they're like, what happened? And they don't know what happened. But what's happening is their stress system is taking over because they have trauma from having tried before and it not working. And now they're trying again and they're like, oh my God, it's not going to work again. So we really have to deal with the mindsets that are in the way of us having the balanced nervous system. And yeah, it's a lot of fun.
We certainly do the same thing in the autoimmune world too. Mindset is the first thing that I work on with my patients because we have to start to slowly train ourselves out of those mindset patterns that we get stuck in. It's like grooves on a record, right? If you
Yeah.
don't change the grooves on the record, it's just going to keep going in the same pattern that it always goes in. But we can slowly shift our thoughts, slowly shift our viewpoint on, what's going on in our lives so that we can slowly, subtly, one thought at a time, start shifting those triggers and start creating a new narrative. So, your
Good.
patients that are being like, everything's good, everything's dandy, let's do this. And then it triggers that fear of everything's perfect, but what if it still doesn't happen? So we start to shift slightly by opening the door to like, just because it hasn't happened before doesn't mean it won't happen now. And maybe that's a subtle shift that we can latch onto and, we can go from there.
Yeah.
So we do the same thing with my autoimmune patients or clients. It's like, we have to open the door in your mind to a different reality that could come out of this and slowly walk those steps until you've created that new groove on the record.
Yep.
Yeah.
So I'm down to do a little practice if you
Let's do
want
it.
a demo.
Yeah.
So this combines two different things. One is breath, and that's honestly, breath is like the easiest one, right? There is lots of evidence for different types of breathing to help reset the nervous system. The simplest is breathing in and out of the nose without the mouth is helping tell your nervous system that you are safe. If you are breathing in and out of your mouth, it's essentially mimicking like if you were running from a lion, you're probably going to be panting. And when you're breathing from your mouth, your nervous system's getting that message of like, oh, I need more sympathetic response rather than parasympathetic. So the simplest, like anybody can do this, just focus on your breath for a few slow breaths that are deep into your belly or womb and have it be through your nose, in and out. So that one is easy. The second one is like a square breathing. So 4 counts in, 4 counts hold, 4 counts out, 4 counts hold. You can do that with 6 counts if you're a pro, 6 or 8 if you're, depending on how much you can hold your breath. Those are all welcome. So what we will do is do the 4-4-4 and combine it with 2 spots that have kind of the most amount of nerves and acupuncture meridians that pass through these 2 points, which are helping to reset the nervous system. So one is if you find your clavicles and like, what is this? The sternum. Sorry. I'm like, what's this? And find the point right below your clavicle on the sides of the sternum. So that's one of the acupuncture points. And the other is 2 fingers over the eyes very gently. And behind the eyes, a whole bunch of nerves and pathways are connecting. These 2 are really good points for that reset to happen. And then we'll just do a few counts, like few breaths with breathing in for 4, hold for 4, out for 4. Hold for 4. In again. In. Hold. Out. Hold. Again. In. Hold. Out. Hold. That's it. And you can just relax your hands. Take a few extra breaths in and out through your nose. How do you feel?
It's a great way to end. Yeah, I do box breathing. Yeah, I do box breathing, but I didn't know about those points. So I'm gonna start doing that for myself.
Yeah. Yeah. I love it. Like that. So I had a little like eye pressure behind my eyes this morning and it's gone.
Nice.
It's gone.
And for anybody that was just listening to this and not watching on video, we were using the thumb and pointer finger on one hand to touch those points under the clavicle, while at the same time with the other hand using the thumb and pointer finger over the eyes while we were doing the breath. Yeah. Thank you for sharing that.
Yeah, absolutely.
And that's something we can do throughout the day. If you're at work, and you feel weird doing that, where people are going to see you, take a bathroom break and just sit for an extra minute on the toilet.
Exactly.
Do that, right?
Yeah, really easy to do on your own wherever you are, right? And there was a point in my life where I was so stressed and I was aware of how stressed I was that I had to set my alarm clock for every hour. And I would literally do this practice every single hour, which sounds insane, but I was like, my nervous system is so wigged out from so much stress for so long. Like, I have to do something as extreme to like get it back to balance. And now I don't need to do it as much, right? I do it when I need to. But if you're in that place where you're not even sure that stress is affecting you, or you're one of those that's like, I'm not stressed, I'm good, everything's perfect, then just try and do this for a week, 3 times a day, and see what happens. And you'll be surprised just how different you start to feel. And you're like, oh, this is what it feels like. And I do a lot of nervous system stuff now, but one of my nervous system coaches is like, the practice that I do in that system is 3 to 4 times a week, just 10 minutes. And when I started doing it, I was like, I'm already doing so much. Like, I have so many tools already. And I was like, okay, I'll just try it for a little bit. And these coaches are like, oh, you'll have more abundance and better health and all the things that come from a balanced, safe nervous system. And I was like, yeah, okay, bullshit. But I can really see the difference, right? So anytime that, for me, like the way I go about it is I have doubt, but I observe, I make sure that I'm like journaling in some way so that I can keep tabs on how I feel different. And I think that within a week, 2 weeks, a month, you start to see and notice changes that you're like, oh, this was really different before. And for me, like, I'm like, oh, I was way less reactive now than I used to be. So that's enough for me to be like, oh yeah, I just got to keep doing this. That's what it's a good practice for me to have. So anytime you want to add new stuff, just check it out. Test it on yourself. See if it works for you. Not the magic for everyone, but
Yeah. And I think that so often it's the smallest things that seem so simple that make the biggest impact if you do them consistently. So,
Mhm.
like you said, doing maybe 5 rounds of the box breath a few
Mhm.
times a day, it's going to take a couple of minutes, 3 times a day.
Yeah.
We can literally all of us have time to do that.
Yeah.
And I know for me, like my brain gets so hyperactive with like the to-do list and all the things. And I know that that's upsetting my nervous system, like my fight or flight's on fire. And it's so hard for me to take the time to sit down and just do the breathing or do
Yeah.
the journaling or whatever it is that I need to
Mhm.
do at that moment to start to calm that down. But I never regret doing it.
Yeah, and like for me, what worked was setting a timer. So every time the timer would go off, I was like, okay. If I was with a patient, I'm like, great. So I'm just gonna interrupt our appointment for you guys to join me in doing this nervous system reset because you need it.
That's
And they'd be
awesome.
like, oh, she's so weird. But it really was just like, it's what I needed to do for myself. And like, I know that it wasn't harming anyone else, and hopefully, like, I inspire them to take action in their own lives. Cause at the end of the day, like, I can tell people to do all kinds of stuff. It doesn't mean that they're doing it.
Right. But I love that you had no qualms with wherever you were at that moment. I'm assuming, unless you were driving or something, um, you would just stop no matter who was there with you, no matter what was going on, and set that example. And that also shows your nervous system that it can trust you.
Mm-hmm.
Like you weren't embarrassed to do it in front of your patients.
Yeah.
It's
Yeah.
amazing. If we can do this in front of our kids, in front of our families at work, and
Oh,
just
yeah.
be that example.
And like getting your kid to do it with you. My kid will always be like, "Oh, can we do that tapping thing?" There's another technique that I have for the brain, and he's so into it. I feel good. Can we do that again?
I love it.
So we're gonna permeate this into the lives around us, and it's helpful for people to see it and for you to be like, oh, I'm just doing a breath. You want to do it with me?
Mhm.
It does this like nervous system thing. I don't know what it is. You don't have to explain it. It's like, how do you feel after? That's it.
Right. Right. That's
Yeah.
all it is. Yeah. And, current climate in the US being what it is right now, I think just having no qualms about doing this stuff, getting yourself calmer, that radiates, like you said, it has that ripple out effect to the people around you. That's just going to help them and so on and so on. And that's the shit we need right now. So,
Amen to that.
uh, on that note, any last thoughts for our listeners and how they can find you if they want to work with you or look into your offerings?
Yeah, the best way to connect is on Instagram at Holistic Fertility Doctor, and our website is holisticfertilityinstitute.com. And I always forget to mention this, but we did a really good deep dive into gut health, stress, a whole bunch of factors that I think are so important for fertility. I have more deep dives on my podcast. So the podcast is Egg Meet Sperm. Feel free to go and check it out.
Thank you so much, Dr. Aumatma. This has been so wonderful. Thanks for sharing your knowledge.
Yeah, thanks for having me again, Holly.
Thank you so much to Dr. Aumatma for sharing her expertise with us again as a holistic fertility expert and naturopathic doctor today. Make sure that you find the link in the show notes for part 1 with Dr. Aumatma. I hope that you're walking away with a deeper understanding of just how gut health, immune balance, and stress regulation are all connected, and that true healing really starts by looking beneath the surface. If this episode spoke to you, remember you don't have to navigate autoimmunity alone. I'd love to support you on your journey. You can find my free daily lupus guide, which also applies to any autoimmune condition, and symptom tracker in the show notes, or you can apply for a free health strategy call if you're ready to go deeper. Until next time, take a deep breath, give yourself grace, and keep building your bridge back to health.